Everybody right to go? There are 289 active cases of coronavirus in Victoria, 15 new cases since my last update. The last time we were under 300 active cases was the 29th of June. 7 of those 15 cases are linked to known outbreaks and complex cases. 8 are under investigation and 1 was reclassified. There have been, I'm sad to report, now 800 Victorians who have lost their lives because of this global pandemic. That's 2 since yesterday's report. 1 female in their 70s, 1 female in their 90s. Both of those deaths are linked to aged care, and of course we send our sincere condolences and best wishes, our sympathies to those 2 families. There are 38 Victorians in hospital, 6 in intensive care, and 3 of those 6 are on a ventilator. A total of 2,709,688 test results have been received since the beginning of the year, which is an increase of 14,709 test results since yesterday. If I can just pause on that for a moment and deal with the usual subject matter that I deal with. I want to say thank you very much to that almost 15,000 people who went and got tested just a little more than a day ago. That's a profound contribution to our collective fight against this virus. I'm deeply grateful to each of you. This is so important. Mild symptoms, even the mildest of symptoms. Don't delay testing. Please go and get tested as soon as you possibly can. That means we can protect you, your family, and we can prevent you from spreading the virus. We can assist you in not spreading the virus to anybody else. That's critically important in terms of us keeping these numbers low and making sure that we can continue to take safe and steady steps towards opening. There are 45 healthcare workers who are active cases. The regional metro split is just 3 active cases in regional local government areas that are under the 3rd step restrictions, which then means the rolling 14-day average to September 30 is Metro Melbourne 15.6 cases and regional Victoria just 0.3 cases. Beyond that, and we've talked so often about the importance of mystery cases and the unique status that they hold, over the period 15 September to 28 September, so that 14-day rolling period, there have been no mystery cases in regional Victoria and 19 mystery cases in metropolitan Melbourne. Those numbers have been steadily falling and we anticipate that trend to continue. In terms of aged care active cases, there are 135 active cases in aged care. In disability facility settings, there's just 1 active case, that is a staff member. And if I can draw to your attention that as at the 30th of September, some 4,791 shifts have been worked by hospital staff in our aged care facilities, in private aged care. I want to thank each and every one of those many thousands of staff who have worked those shifts. Never would they perhaps have thought that they would be called upon to work in a residential aged care setting, let alone a private residential aged care setting. They've gone and done amazing work, very challenging circumstances, often particularly traumatic circumstances in private aged care, but they've done that job and they've done all of us very proud, and I want to thank each and every one of those staff on behalf of all Victorians. Almost 5,000 shifts. That is a very substantial effort. But it's not surprising when you think about the commitment, the care, the compassion and the competence of these staff. They are quite amazing, and I thank each of them and I honour them for the work they do in every setting, every hour of every shift right across our state. That probably concludes the numbers of the day, as it were. I will just make a couple of general comments. To have that number down now, just 289 active cases, that number continues to fall. To have just 15 new cases today, where in previous days we've reported similar numbers and have been able to close out those cases quite strongly in terms of contact tracing, finding where they got the virus, isolating them, isolating their close contacts, pulling it up if you like. That's a really important thing. This strategy is working and people can be rightly optimistic and hopeful about the 19th of October. We've just got to find that within ourselves, despite the challenges, despite the frustration, which is a perfectly understandable thing. I think that Victorians across the board know and understand that unless we do this properly, unless we take safe and steady steps, then we simply will be frittering away all the hard work, all the sacrifice, the quite amazing efforts that Victorians have gone to, for which I am deeply grateful and more than a little proud. The Victorian community has risen to this challenge so well. We've just got to see this through. It'd be great to be able to make a decision today and stand here and announce that we can open everything up tomorrow, but I think most Victorians, the vast majority of Victorians, know that that would not be a wise decision, it would not be sound, and it would almost certainly mean that we were back in a form of restrictions, whatever that might be, that would be far more onerous than what we hope to build and what we're confident we'll be able to build. A COVID normal Christmas, a COVID normal summer, and a set of a virus at such a low level that we can sustain that over the long term. That may even be for the majority or indeed the entirety of 2021. I think the vast majority of Victorians are determined to have a very different 2021 when compared to 2020, and that is all about making sure that we get these numbers low, open up, steady, safe, and stay open, and keep those numbers low. And I want to thank every single Victorian who's out there doing what has to be done. It's not to say that everybody's enjoying the predicament, the challenges we face, but we haven't got the luxury of pretending that because we want this to be over, it's over. We haven't got the luxury of pretending that because we're frustrated with this, we can somehow cheat this thing. You can't. It's got to be defeated properly. There's no shortcuts in that, and we've just got to see this through. And I'm very proud that Victorians are very much aware of that. Very much aware of that. Once, of course, the health challenge is dealt with in this latest phase, that's when we can really pivot to providing the economic repair, the confidence, the investment, so that this economy can lead our nation again. And that's exactly what we'll do. Jobs and skills, investment and confidence, the biggest budget, the biggest program of repair that this state has ever seen. That's what the Governor of the Reserve Bank has called upon us to do. That's what the Secretary of the Commonwealth Treasury has called upon us to do. That's what common sense tells you must be done, and we will get that job done. All of us together as Victorians, workers and business, the public sector and the private sector, working together, state and federal, to make sure that we are back at our best as soon as we can possibly get there. I'm now going to throw to Professor Cheng to speak about a number of matters, including sewerage testing down in the Anglesey area, as well as just the numbers of the day and the trends as he sees them unfolding. And we're also heading into that thunderstorm asthma season, and we know how important it is that people have up-to-date asthma management plans and all of those issues. So I'll ask him to speak to that, and then Minister Donnellan is going to speak about some important announcements to provide some support, further support, to some in our community who are doing it very, very tough. So I'll hand over to Alan now.
Thanks, Barry. So I'm just going to talk about some of the outbreak investigations and making sure people get tested. I'm going to talk about some of the technical issues that have come up with data, that just to clarify, and then to talk about hay fever and thunderstorm asthma. So firstly, on the outbreaks, we have a bit of a situation in Frankston that's linked to the Chadstone cases. So at Chadstone, there have been 8 cases in the fresh food part of Chadstone. The staff have been contact traced and cleaning has occurred, so it's perfectly safe to go back into Chadstone at this time. There's been a case that has worked there since from the 23rd to the 28th of September. So any people that have been into that area over that time, if they have the slightest symptoms, if you could please come forward to be tested, that would be great. There is a drive-through clinic for the public at Chadstone's Golfers Drive, Gate 4, and there is going to be a pop-up clinic, a drive-through clinic in the Chadstone Shopping Centre from tomorrow. We'd like to thank management for really getting onto this very quickly and for their cooperation in working with all the other employees at Chadstone Shopping Centre. At Frankston, there is an outbreak that involves a household that are being supported to isolate. At Frankston, there is a pop-up clinic at the Peninsula Aquatic Recreation Centre. So there's no public exposure site at that in that area, but obviously for those who have been or who have symptoms in Frankston, if you could come forward for testing, that will help us find cases and trace contacts. At Anglesey, 2 wastewater testing results have been positive, and because they're 2 different tests over different days, it's likely that it's not someone that's just passing through Anglesey, that it's likely to be a resident. This could mean that there is someone with active infection in Anglesey, but also could mean that it's someone that has recovered from an infection that is in Anglesey, and we obviously can't tell the difference just from testing. Just to emphasise that this is wastewater and not drinking water and not felt to be infectious. These are viral fragments, and there's no reason to, for example, boil water or anything like that. There's been a great response from the community. We'd like to thank the Surf Coast Shire and the local community leaders network for helping with the community response. Almost 3% of the township of Anglesey has been tested yesterday, and those results are pending. There is a pop-up clinic at the Anglesey Town Hall at Macmillan Street that'll be open from 11 a.m. to 6 p.m. Today, and from 10 a.m. to 6 p.m. each day until at least Sunday. In terms of some of the data issues that have come up a number of times, we've been reporting mystery cases, and just to emphasise that mystery cases are reported as of 2 days ago to allow us time to close out investigations. So there have been 19 cases in the 2 weeks up to the 28th of September. Mystery cases have roughly been halving week on week for the last 4 weeks, and there have been 9 cases in the period of the 15th to the 17th, so over the next 3 days those 9 cases will fall out of this reporting window. Since then there was 1 case on the 20th of September, and then 9 cases again between the 22nd and the 25th of September. It's important to note that these mystery cases are in 14 different LGAs, so they are very widely distributed, and they do suggest that obviously a mystery case has got it from someone, so it just reinforces the need for people with symptoms to come forward for testing wherever they are in Melbourne. In terms of reclassifications, there's sort of 2 main types of these, and this has come up a number of times in questions. So firstly is reassigning the sources of existing cases. So mainly these are from under investigation to another category. So they're under investigation, they get reassigned to contact with a confirmed case or a mystery case. And it obviously takes some time to do this, and sometimes we only find out a source when we've done testing of close contacts, and that can take a few days. So of the 82 cases in the last week, 68 were originally down as under investigation, of which 49 changed to contact with case, and 6 were changed from under investigation to unknown source, and 13 still remain under investigation. The second type of reclassification are those that affect the total case number, and these are usually duplications. So obviously every positive test is notified to the department, and we want to be very sure that when we have a case that looks like the same name as someone else, that actually is the same person. So we go through a process to just make sure that they are in fact duplications. So in the last week there were 6 reclassifications of this type. 4 of those were duplications, and 2 were felt to be false positive results. So finally, just want to talk about epidemic thunderstorm asthma. So it's the beginning of October. So the period from October to December is a time that epidemic thunderstorm asthma can occur, and this is a result of high levels of grass pollen, particularly ryegrass in the air, and when that's combined with certain thunderstorm conditions, particularly high winds, that can lead to thunderstorm asthma. And as some people may remember, on the 21st of November in 2016, we had a very large epidemic of asthma. There are 4 groups of people that are at risk of thunderstorm asthma. So obviously people that know they have asthma, people that haven't yet been diagnosed as having asthma, so people that may have a wheeze or other symptoms like that, people that used to have asthma and think that it's controlled now, and then there are people with hay fever. So if you're in any one of those groups, you should see your GP and make sure that you have an action plan in case something happens. There have been a lot of changes to recommendations about medications over the last year, so if you haven't, even if you have seen your GP but haven't seen them for a little while, it may be worth going back to make sure that the medication that you're on is appropriate. There are pollen count measures around the city that are run by the University of Melbourne, pollen monitors, and some of these results are pushed out through the Victorian Emergency app and the website, as well as on the University of Melbourne website. So if there are situations where there's high pollen in the air and there are systems to look at monitoring of hospital admissions and other things. If there are events presenting to hospitals, then these warnings will be pushed out. It's likely that this year is looking like a La Nina year, which is a wetter year than it is normally, and this is likely to mean that it is somewhat of a higher risk of thunderstorms, although the pollen forecast at this stage is only that it probably is going to be moderate. So I think they're the main things that I wanted to cover. Minister Denelon, thank you.
Thank you. Today I've got the pleasure of announcing an increase in the Extreme Hardship Support Program. So in other words, this program's been running since July through the auspices of the Red Cross with the support of the Brotherhood of St Lawrence and 140 different community organisations. These payments were at $400 for an individual and potentially $400 plus for those in a family. This is specifically focused on those with provisional and temporary visas and undocumented migrants. Those people who may have lost work, may be partners of Australian citizens, may be seeking refugee status in this country. And as we know, a lot of casual and part-time work is not necessarily available at the moment, and many of these people in our community are currently being supported both by community organisations, but more than anything else, there's a need for us as a government to actually step up to the plate. So, in other words, we're increasing the payment for an individual today to $800, and they would receive potentially up to 2 payments over a period of 2 months. So they'd get the first payment in the first month, and then 2 months later they'd be eligible to apply again for an $800 payment. As I've indicated, the payments would be more for families. This is vital that we, in many ways, reach out to those people who are incredibly vulnerable in our community, those people who may not have income, those people in the community who are probably being supported in many ways by other community members presently. And we as a government need to step in to actually assist that. The Red Cross is running this service, and the Brotherhood of St Lawrence is reaching out to, I think it's over 140 different groups that provide that support. To date, we've had 8,300 payments put out there into the community. We've had 20,000 people referred for other services, whether it be rent assistance, mental health support, and other support. Our expectation is it's potentially that about 25,000 people may require these payments to assist them to get through this incredibly difficult period. Thank you.
We are happy to take any questions you have.
I might just ask Alan, if I can, about the Frankston outbreak.
Sure.
And what that looks like. I know you probably can't talk specifically given you don't want to ID that household, but can you tell us how many people in that household have COVID? Do they all work at Chadstone? What the makeup is there?
So I can't remember exactly the number. I think it's sort of about 8 or 9 people in the household. One of the members works at Chadstone, and I don't know off the top of my head how many cases, but I think a lot of them have had infection. They are being supported to isolate, and they've been. We really thank them for their cooperation.
And what percentage of that family make up our new daily case numbers today?
I couldn't tell you off the top of my head. It has been over the last couple of days, so it hasn't all been yesterday.
Alan, you talked about thunderstorm asthma, hay fever seasons here too.
Yes.
What should people do when they've got symptoms very similar to C19 symptoms.
Yeah, so that is going to be a bit of an issue. So a runny nose is found in about 26% of people, and I can't tell you how many people that, certainly my experience at the Alfred, how many people we've called and they said, oh, I wasn't sure if it was, I got a test and then, it was positive. So if you have any, any doubt over the symptoms, please come forward and get tested. I think that, and particularly if there are any additional symptoms, so if there's fever or a cough, if the hay fever is more severe than usual, or any sort of doubt, particularly at this time while we're still trying to find every last case, I think it's important to come forward to be tested.
Are you confident you followed up with the close contacts of that worker at Chadstone?
Yeah, so the management at Chadstone have been really cooperative. There's a clinic that's been stood up for the employees at Chadstone, but all the close contacts have been traced and have been tested.
There was a cluster about a month ago, a bit over a month ago, in spotless workers at Chadstone. Is there any link, or is that so long ago that there's no link?
Not that I'm aware of. No.
In terms of contact tracing, is there still issues with contacting people who English isn't their first language, and there's actually a delay in identifying people that can communicate with these people to do the contact tracing?
So not at the moment, but I do understand I think it's about 10 or 12% of people that have had infection don't speak English as a first language and require an interpreter. In recent days, I don't think we've had any issues with that.
There seems to be a little bit of confusion over Ashwood's Woolworths that's been listed as a high-risk location. I think DHHS says that the exposure happened on the 26th, and Woolworths is saying that it happened on the 25th. And they're also saying they weren't notified by DHHS contact tracers until the 29th, which...
I'll have to follow up on that. I've got the list of the new ones here, but that's not on that list.
Okay.
Does staff at that butcher need to be tested? We've seen the rollout of the industry testing for food industries.
Yep.
Is that butcher, does it have more than 25 employees? Will those staff be tested?
I'm not sure of that, but it's a retail outlet, not a meat works place. But there certainly is. I think a lot of that meat industry work is being done sort of a bit further upstream.
What's the risk to any of the customers who've been at Chadstone who might have been exposed?
Look, I think it probably is fairly small, but I think it's just important if you've been in that area, and obviously there is the potential for transmission. If you have been in that area and you have symptoms, it's important to come forward for testing.
And then everyone who's been a close contact, they've been cooperative?
Yes, I understand. Yeah. The management at Frankston have been, at Chadstone have been really fantastic. All the cleaning's been done. It's certainly perfectly safe to go back into Chadstone now.
Just one for the Premier. Sorry. If Melbourne is above that 5 cases over the 14-day average, but they're linked, some of those cases are linked to aged care or known outbreaks, is there a chance that we can move to the next step?
Yeah, Bridget, we've made the point a number of times now that particularly as numbers get this low, and Alan I think particularly has made the point about chance and how the random nature of human activity can be a pretty significant part of this. So we'll look not just at the numbers, but we'll look at the narrative or the story that sits behind them. Every case is unique. Some will have links and at a kind of epi level, but they'll also have similar stories. Got it in your household, someone got it from a workplace, that workplace is known, whether it be aged care, health, the list goes on. So we'd look behind each of those numbers and we would make a judgment. The public health team would make a judgment and advise me on whether we were safe to go or not. The modelling and our experience, not just the assumptions, but the actual data, sees us trending into a place where that step is possible. In fact, a lot likely would be the landing. But we do have to wait and see how things unfold in the next three weeks or so. But it won't just be on those hard and fast numbers. It has to be what sits behind them. And that's why, for instance, we've made the point a number of times that you could, toward the back end of that 14-day period, you could have a number of cases, 8 or 10 cases, for instance, that would potentially throw your number target out. But if you were confident that they weren't mystery cases, that we had wrapped around all those people the support that they need, that we had a a good and complete list of their close contacts and the same treatment had been given to them all the way through, we'll look not just at the numbers but at the stories that sit behind those cases as well.
How hardline are you likely to be on mystery cases? So, you know, if we were, for example, under that 14-day daily average of 5, but we had 8 mystery cases, would you be saying, no, sorry, like we're too concerned about the mystery cases, we won't be opening up yet?
It's very difficult to be hard and fast on that because there are mystery cases and then there are different types, if you like, in terms of the size and scale, and you may have some doubts about, you might not be able to establish to a standard where the person got it, but you may have a theory, you may have a view. So it's also about how many there are. If it were just 1 or 2, then the real challenge here, and again, if you strip it all back, it's reasonably simple. A person's got it, we can't work out where they got it from. Well, they got it from at least one other person. So the person who's got it has got close contacts, the person they got it from has got close contacts as well, and what in that, if you were to map this all out with a series of lines heading towards people, that could potentially be quite a significant number of people. That's why upstream and downstream testing, surveillance testing, and a solid testing rate for those who are symptomatic. That's all part of this mix. But it is a bit difficult, Rachel, for us to be completely certain on that. It will depend on how many, and they have narratives also. They have narratives that sit behind each of those cases as well.
Can you just clarify, is travel out of Melbourne allowed under Step 3?
In terms of travelling to where?
To regional Victoria, because under the roadmap it says you can travel interstate in the next step, but yesterday it seemed...
It will depend, Bridget, it will depend on a couple of things. One, the detailed advice that I get, and 2, the amount of virus that's in Melbourne. Assuming we can take that next step though, that may be safe within Melbourne. Whether it's safe to have a free movement without rules into regional Victoria, that matter's not been settled. But we are turning our mind to that, and we'll be very clear with people on or about the 19th, when hopefully we can take that next step in Metro Melbourne. We'll be very clear with people about what travel opportunities there are. I think that certainly all the regional Victorian leaders and others that I speak to are very keen to make sure that we don't do anything that compromises the very low virus status. So just 0.3 cases per day over a 14-day period. No one in regional Victoria wants that to be compromised. And I know and understand that there'll be many people who, for the best of reasons, want to travel to regional areas, whether it be to see family, whether it be to see friends, whether it be to attend to a whole range of important matters. But we just have to be really careful not to put at risk what regional Victorians have been able to achieve, and that is very, very low virus status. But we'll have more to say about that when we get to that point. Nobody will be in any doubt, Bridget, by the time we get to the 19th about what the weeks after that look like for the purposes of travel.
But even if we move to the next step and our daily average is only 5 cases, you're saying that still might be unsafe to travel to regional Victoria?
What I'm saying is we haven't landed on that, and there may be some travel that we don't think is safe. We may have an expanded list of reasons why you can go, but I can't at this stage. We may get to that point, but I can't at this stage say that ring of steel, as it's been called, will just be thrown open and everybody can travel right throughout the state. That may not be a smart thing to do at that point, but that shouldn't also be read to mean that, you know, for all of the second half of October and all of November, that those rules would stay in place. There might be a shorter period, for instance. It's just I know I asked the question. It's really important, and on a very personal note, my mum would be very keen to see that boundary go, and yours too. And I get it. There's some economic reasons. There's all sorts of reasons, but the ones that I think are perhaps the most powerful are those personal links, and not being able to see the people that you love is very, very hard. So we'll get that done as soon as we possibly can, and you can pass that message on to your mum from me. We'll get there as quickly as we possibly can.
Premier, why were those security guards stood down mid-shift at the Novotel Hotel?
Well, no, it's really clear to be detailed about this. Victoria Police provide security. Private companies don't provide security, and the Alfred has made that clear. This is a program that's being transitioned. It's a very different program, obviously, to what it was, and it will potentially have to change again once we get to a point where we've got international flights coming back. So there'll be a scale and a volume there that is certainly much greater than what it is now. And the other point, of course, is that we await the findings of the board, and I think they will. Again, I'm not preempting it, but I think it's only logical that they're going to have views about what sort of a system should be run, and maybe even who should be required to go into that sort of a quarantine model. So you've got Department of Justice. Start at the top. You've got Corrections Victoria. They are running that program. You've got security provided by Victoria Police. You've got cleaning, for instance. I don't think anyone expects members of Victoria Police to be cleaning rooms, so you've got a company that is employed to do that work. And you've got then Alfred Health, who are providing healthcare, obviously, welfare, some of those other important functions, the importance of which I think has been pretty well canvassed during the work of the board.
So what were those spotless workers doing if they weren't providing security?
They weren't providing security, and Alfred Health's made that clear. They were providing, I suppose you could say it was an extension of welfare work. I would have thought, they're in place. Someone needs something, if there were an issue, they would go and alert Victoria Police, for instance, and they would deal with that issue. That's the understanding I have.
And they got sent home halfway through or midway through the shift.
Well, and Victoria Police have taken their place. And
why did that happen?
Sorry?
Why did that occur?
Well, as I understand it, there are a series of different points at which the program is changing and evolving, and I couldn't, for instance, as I stand here now, say to you that is the last change. There is a program to transition, and I suppose the best example of that is that we have gone from Grand Chancellor and the Brady. The Brady's now closed, as I'm advised this morning, as part of that program. That didn't happen yesterday. That's a program that's part of a long-term piece of work, and they have gone to the Novotel South Wharf. So it's not settled in that there's. Well, I can't list for you what the next 3-4 changes will be, but it's not necessarily settled, and it'll continue to evolve, and it can, because we've got the freeze on international arrivals coming back. But of course, it will need to be finally landed so that it can then be in whatever form, by which I mean how many rooms will be needed, stepped up to scale once we've got flights coming back here.
Sure, but sending workers home before they've concluded their shift isn't really consistent with the transitional process, is it?
Well, again, this is what's occurred. That's the advice I have. I can't provide you any further background to that.
The health worker's told The Age that she fears that the practices of spotless staff in hotel quarantine could spark a third wave of coronavirus. She says, quote unquote, when international flights start again, Victoria will be screwed. How and why do we still have poorly trained casual workers working in hotel quarantine, particularly when you've personally assured us that these environments are now being treated like hospitals? I don't necessarily agree with the conclusion you've drawn about the quality of training or the... This health worker does.
Well, there's an unnamed health worker. She's entitled, whomever that might be, to have a view. That's not the advice that's been provided to me in terms of training and in terms of the terms under which those people are employed. That's not consistent with the advice that's been provided to me.
So just to clarify, you're saying Victoria Police were guarding the hotel. Spotless workers who are security staff were there as a support staff, not for security, and that they were removed halfway during their fitness.
I would refer you to the Alfred Health statement, which makes it very clear that they were not providing security.
But they are security staff hired by...
Well, no. Then if you're not providing security, then you're not security staff. The statement of Alfred Health makes that very clear. Victoria Police are providing the security there, Alex. They are providing the security there. And
Is this something that the ADF could do, possibly? Why are we still using casual work staff when there's clearly consistently problems when we have the offer of additional
Alex,
staff?
I don't think the ADF are going to be cleaning rooms. So I don't think Victoria
Police... But
Police...
you said that these people weren't cleaners. You said that they were
they're
supporting Victoria Police.
That's right. And again, they're
so
not providing...
So are they cleaners, or are they security staff,
Well, again,
or are they support workers? Which one are they?
Well, as I've just said to you, have a look at what Alfred Health has said. Alfred Health has made it very clear they don't provide security. So they're not providing security. The site is secured by Victoria Police.
And why again did Victoria Police come in and take these people off their shift in the middle of the shift?
Well, there's a transition, a plan to a new set of arrangements that's unfolding. For instance, if you'd asked me, say, 2 or 3 weeks ago, would we be going from Grand Chancellor and Brady to Grand Chancellor and Novotel South Wharf, I probably would have said to you that I wasn't aware of that. Yet there have been plans for some time, as I take it, to transition away from the Brady Hotel to the Novotel South Wharf. So there is change in this program, and there is an ability to implement that change because it's only got about 100 people in it, the vast majority of which are people who have voluntarily and in fact asked us to house them because they don't have domestic arrangements that would be suitable. There are a small number of international arrivals who, for compassionate grounds, have been granted an exemption to come. That's a fairly small number, but it's a very different program dealing with a very different risk profile, dealing with different cohorts of people. It will, of course, you're right to say, I think we're all right to acknowledge that it will have to change yet again in weeks and months ahead once we finish up with many thousands of people coming back via international flights.
Premier, you're not seriously expecting us to believe that it was part of the plan for people to leave their work mid-shift, though, are you?
Well, again, I can't provide you any further details than I have. I'm more than happy to ask the question for you and provide you with whatever further information I've got.
And what was the reason for moving from Brady to Novotel?
I'm not certain. There's, I think we should probably acknowledge and thank the Brady Hotel for the work that they've done over a considerable period of time. But I don't have any further details beyond that. If I can provide any further, I will.
Are you confident that we have learnt from the mistakes that were made the first time round and that those mistakes aren't still being perpetuated in that environment?
Yes, I am.
What gives you that confidence, given what we've read in the papers today?
Well, I've got advice. I haven't got... When people provide me advice, then they actually put their name to it, which I think is really a very important thing. I'm not having a go at anybody who decides to speak to a journalist. That's everyone's right. But I don't think there's an equivalence between a comment, as you've taken me to, and the advice that I've got from various departments and agencies. I'm confident that the arrangements we have in place are vastly different to those which we have all become very well aware of through the work of the board. But I can't for a moment stand here and say that the model that operates right now wouldn't change again. There wouldn't be further refinements and changes based on practice, based on the recommendations of the board, based on whatever decisions National Cabinet makes, for instance, about who should go into quarantine. There's been some speculation this week about, as the Prime Minister put it, a kind of a triage model. All of those things are not yet settled, but I'm confident that that's a secure environment and people are doing the very best that they can. And the reason I say that, to your question, is that's the advice I've got.
The board made a decision yesterday on the basis of the fact that we did finally find out that there'd been 9 workers who have tested positive who in hotel quarantine since late July. They'd made the decision yesterday to investigate, I guess, reopen their investigation into the current arrangements. Do you welcome that?
Well, I haven't seen the exact wording of the board statement, but I think that, again, I don't want to speculate, but I would have thought that this was probably a matter they were already looking at in terms of, as they come to a view potentially about what the program, when it's recommenced at scale, what it should look like. So I'm not sure whether that's a new or a different thing, but what the board looks at and the terms in which they look at it is entirely a matter for them.
You mentioned flights returning, Premier. International flights, that's still... After the board returns its findings.
Yes, I think it's only fair that we, having asked Judge Coate and that inquiry to do its important work, I think it's only fair and reasonable that we wait and see what the findings are. And again, I'm not wanting to preempt what they might be or to kind of in any way influence that. It's an independent process, but I think it's highly unlikely that they won't go directly to some of these issues. And I think that will mean we can have even more confidence in whatever model we set up, that it comes with the benefit of having examined 290,000 pages of documents, having heard from many witnesses, and having given these arrangements a very thorough. It's been a very thorough process, and I think it can probably help us. In fact, I'm certain it will. So there is work going on in the background to be ready. We don't want to wait around for a couple of months, for instance, to wait to get those flights going again. We'll get them there as quick as we can. But I think it just makes sense to wait and see what the board says, and they may have a whole range of ideas. They may have a whole range of issues that they raise that we can again, as part of that further improvement, that evolving model, we can put those in place.
When journalists first started asking questions last week about how many workers in hotel quarantine since it's been revamped have tested positive for coronavirus, they received a statement from the Department of Justice spokeswoman saying simply that no Department of Justice employees had been infected, and that just because there'd been 12 WorkSafe reports didn't necessarily mean that 12 people had been infected. There were no details, despite the fact that the question was asked specifically by multiple journalists of how many people had tested positive while working in those environments. It took 4 days to get the answer that 9 actually had. Is that good enough?
Well, again, I don't draft Department of Justice statements, and it's always been my practice, Rachel, if I take a matter on notice here on any given day, me and my team work as hard as we can to get you the answer in both accurate terms and in as timely a fashion as possible. In terms of my approach to these matters, I think that's very well understood. And I would expect that others had the same approach: be accurate and be timely. That is my view.
Is there any suggestion that cases since you called the inquiry, that there has been further community cases resulting from hotel quarantine?
Sorry,
So-
I'm
so-
not
so the
quite sorry.
hotels
Just so I can follow. So
since
cases
you called
linked to the
current hotels that you've got operating, so we've had the inquiry. Well, we have the inquiry ongoing. We still have the hotel program ongoing, and you
Yes.
say that it's constantly changing. Are there any cases, not workers, but close contacts or members of the community that have coronavirus that can be linked back to the hotels which are currently operating?
Not that
or
I'm
were
aware.
since you asked for the inquiry.
Not that I'm aware of, but that
Could
has.
we check up on that and see if there has
Certainly,
been a
Alex.
leak of cases again?
Certainly, I'll be more than happy to ask the public health team to have a look at that for you.
Regional masks. A lot of
Yes.
community leaders have said that they're quite happy to continue wearing masks
Yep.
for now, but they would like travel, and they would also like a commitment to review the policy as the temperatures increase. Would you commit to
And
that?
they'd like pubs open, and they'd like lots of different stuff, and that's fine. And they'd like tourists to be able to come from Melbourne, and there are lots of things that we'd all like, and I understand why. I think Bridget and I have just had a conversation about some things that our respective families would like. There's a lot of things that people are desperate for. We get that. We just got to do it in a safe and steady way. In terms of the answer on a commitment to a review, masks are under review all the time because everything's under review all the time. That's not a special thing, and I wouldn't invite you to necessarily conclude from that and write a story tomorrow that masks are going to go next week or something. They'll be there for as long as they serve a purpose, and I think they do serve a purpose. I've been very frank. I'm not the provider of the public health advice, but logic tells me, and I've been very clear with you, that I'll be a holdout on this because I think it is, as I've said before, low cost but a very substantial benefit. And if it allows us to have, Alex, I think a greater amount of freedom in whatever form that takes, whether it be social freedom, economic freedom, then I think it's worth it. But I think I've acknowledged many times that it is more challenging when we get into the summer. It doesn't make it impossible, but it is more challenging than perhaps it is when things are much colder. But all those factors will come into it. And I suppose the other point I make is it's a bit linked to some of the points you were making before. If you had pretty much free movement between metropolitan Melbourne and regional Victoria, that then could be a reason why you kept masks on for longer, because you've got, even at low numbers, you've got one part of the state with high virus or higher virus travelling to an area with very low virus, and masks might well be judged by the experts as a useful thing to do. Not exclusively. Hand hygiene will still be important. Cough etiquette. You don't wear the mask all the time. Not going to work when you're sick. The list goes on and on. Just keeping it 1.5 metres. All of those sorts of things.
Some people have suggested a more nuanced approach rather than a blanket approach, such as if you're in a highly built up
Sure.
area with many people, while if you're out walking along a road where there's nobody, should you have to wear your mask?
Well, in my judgment, the definition of nuance is very clearly shown by the fact that regional Victoria is in a different place based on the case numbers. you've got to be careful, I think, whilst the many people call for nuance, actually delivering it with a set of rules that are easily enforced, easily understood. That can be sometimes a little bit more challenging. Where we can have a differential approach that's based on risk, where we can have a differential approach that's based on the case numbers, as well as the story that sits behind them, that is exactly what we'll do. And indeed, it's what we have done.
The Royal Commission dropped their special report into the aged care sector during the pandemic today.
Yes.
Will you be having conversations with the Prime Minister as to the recommendations in that report and how quickly we get them implemented here?
There are... I'm not certain. I'm not certain, Chanel, but what I can say is that we're in constant discussions, minister to minister, government to government, and indeed agencies too, around inherent vulnerabilities in our private aged care system and inherent vulnerabilities in aged care more broadly because of the nature of the people who live in aged care homes. And that remains a concern for us. And whilst the case numbers have come right down, there is a need for that continuous improvement, monitoring, the best culture possible, so that we've got all the safety stuff as robust as possible. Senior health officials, both the Minister for Health and the Minister for Aged Care and myself had a very important discussion as recently as late yesterday, Arvo, about this. So look, I'll read the report, or at least its findings, and if there's any part for us to play in doing even more than the 5,000 shifts that have been provided into these facilities, then of course we will. I'm not briefed on it though. I'm not sure whether they've even released it yet today, have they? I think it's coming later, perhaps later on today.
Yeah, later on today.
Yeah.
Is that going to be a sort of a semi-permanent arrangement with state government resources being poured into the aged care sector?
Well, I think it's based on need, and to be honest, I don't think we see it as our money, their money. I think it's, if you've got a problem, then you work hard, all of you together, to try and fix it. Let's wait and see what the aged care report says. Not just the COVID element of their report, but I'm not entirely sure when the final report of that Royal Commission is due. It's not this year, I don't think. It'll be next year, and the Minister might have a better sense of that. But we'll look at all those findings. There are big differences between the way public aged care is staffed and set up, and the way the private system works. They're well known. They're, I think, very well known. And we're always an advocate, not just of what we think should happen, but what we actually do. We have ratios. We have a very different staffing profile. And that's not a criticism of staff who work in private aged care. They work incredibly hard, and we thank them for the work that they do. But there are clear differences. So we would remain an advocate for the things we do in our 200 aged care facilities being done in every single aged care home. That is our view. If we didn't think that was a good thing to do, then we wouldn't do it in the ones that we run.
So are you prepared to wait for the Royal Commission process to go through? Reform is urgent.
Yep.
We've seen that.
No, we can agree on that.
Weeks and
Sure.
months. So is there scope for the state government to go it alone with permanent reform of the sector?
Well, no, I think the key point here is that it's not our system. And I don't want anyone who might have just tuned in to think that we're not doing everything we can, but it's not our system. We don't fund it.
Like
we don't.
Industrial relations and in other policy areas.
Yeah. No, I'm trying to be as clear as I can. We've got a couple of hundred aged care settings that we run. There are then many hundreds more than that are not run by us. They're not funded by us. They're not regulated by us. It's a different system, and that's why there's a national aged care inquiry, and it's led by the federal government because it's a federal system. That's just it's not a value judgment. It's just a statement of fact. We stayed in this marketplace or in this system, this sector, when other states decided to go a different way. This was a point of contention, I think, if memory serves me, in the 2014 election, and then we made further commitments to strengthen, to build more aged care beds, to have our part of the system actually grow. The Minister was here just a few weeks ago. It seems a few weeks ago, it might have only been a few days ago, talking about a package of, I think, around $30 million worth of grants and various upgrades for the public residential aged care. But it's not a system that I can necessarily kind of reach into and fundamentally change. And you wouldn't do that, I think, Noel, until you got the Royal Commission's report with whatever findings they made.
Regional businesses are disappointed because they have to wait for the next step for Victoria to record, all of Victoria to record 0 cases for 14 days. Would you look at changing that so they might be able to go it alone and open up a bit earlier?
Yeah, we're certainly looking at whether there are further steps that can be taken in regional Victoria, but they have to be safe, they have to be steady, and I would just say that whilst the low case numbers in regional Victoria are very pleasing, and all the reports and advice I get about regional Victorian businesses being, absolutely serious about COVID safety and doing a fantastic job, it's only a couple of weeks. So we've talked often about that sort of 3-week cycle, 2 to 3 week cycle, to know what the impact of decisions you made back then are. Those arrangements as they operate in regional Victoria are not long-standing. They're very welcome and we think they're safe. But as every day goes past, that's a validation or otherwise of the decisions we made some time ago. So I think it's with the greatest of respect to those businesses who, not just for profit, but for their people, for their community, they want to open up more, but it's a bit too early for us to do that now. But there may come a time in a few weeks' time to be able to take some further steps. I would just caution against any great expectations that we can go from 20 people inside to 50 or 100. We know that indoor settings are 20 times more dangerous. So it's just one of those, it's very, very challenging. But we may be able to do more in other areas. So we'll look at all of those things. We are looking at all those things, and when we're ready to make announcements, we will.
Would you welcome the other states opening up their borders to regional Victoria, so South Australia and New South Wales?
Well, it makes perfect sense. If you can travel from Mildura to Orbost, based on the fact that they're both communities with very low virus, if any, then it makes sense that you can travel what is essentially a pretty arbitrary border. And we've seen this has been a feature of a lot of the discussion we've had in recent weeks and months, that there's a lot of people in those, I think it's 8 or 9 border towns up and down the South Australian border who, they're proud Victorians, but they get their fuel, they get their groceries, they get their medical appointments, they travel into South Australia to get that. So it makes sense to me. I know it's a bit emotive, like why can you go to another state but you can't come to Melbourne, and vice versa. The issue is that that's travel between communities that are linked by one thing at least, and that is that there's low virus. And I don't think you'd want it any other way.
Have you had discussions with the other premiers about that possibility?
No. And I'm very, but I'm very. There's Jack Symes has dealt with a lot of this at a ministerial level, and I can't say that we wouldn't push for some further clarification around some of those things, some of the purposes for which you can travel. But we would obviously welcome that, and the best thing we can do is to keep driving these numbers down, stay the course, get to a point where we've got very, very low numbers, and then it won't be so much regional Victorians being able to go to Sydney, it'll be all Victorians being able to go to Sydney. But I would just say, do that only if you have to, like holiday in Victoria, travel in Victoria. I'm kind of obliged to say that, but it's also true. The best experiences will be in country Victoria this summer, or in Melbourne if you live in country Victoria. And we hope to be able to get to that freedom of movement within our state. Again, others are free to make their own judgments if they want to go to another state, but I'd be an absolute champion for holidaying at home and spending as much of your hard-earned as you can to support the economic recovery that we're all fundamentally committed to.
Just on hotels again, can you confirm when police went into Novotel? Because Alfred Health have told us just of an hour ago that cleaning staff were being used as floor monitors.
I can't confirm that, but I'm more than happy to try and come back to you.
So do you know when police were a presence there?
No, I can't give you an exact time, but I'm more than happy to have someone come back to you.
You also referred us to Alfred Health's statement. They've just confirmed they haven't put out a statement. Who told you that those staff were not being used?
I understood that they had made a statement.
They haven't made a statement.
Well, I was advised by my staff prior to this press conference that they'd made a statement.
The Department of Justice and Community Safety has made a statement, but Alfred Health has said nothing.
Well, that's not the advice I have. But I'm not wanting to have an argument with you, Candice, so that's the advice that I had.
So who told you that they weren't being used as security personnel?
My staff have indicated to me that Alfred Health had clarified that matter. If you, I'm happy to check it, but that's the advice that I was provided before I came into the press conference.
They've just texted us saying that they heard you talking about the statement
but they haven't put one out.
Well, I'm not quite sure whether you want me to be doing any more than what I've just committed. I've just said to you, that's the advice I have. If that advice is not correct, then we'll come back to you. But that's the advice I was provided.
Just to clarify, you don't know when police, as Chanel was saying, when police were in those hotels, or if they were in those hotels prior to yesterday?
No, police have been in those hotels for months. They've been providing security. They have been in charge of the security of those hotels. I think the question was not whether they were there or not there. It's about whether there were more police went in, as I understood the question.
When did they start being a presence there? When were they first moved in there? Was it from the start of?
Oh, I can come back to you, but police have been. I will come, as I've just said to you, I'll come back to you. But I don't think it is correct to say that they haven't been there as a feature of this program since it's been reset, or at least the beginning of that reset process. They've been there doing that work and overseeing that work together with Corrections Victoria staff for a lengthy period of time. The only reason I'm hesitant to give you a date is that I don't actually have the exact date, but they've been there from the start of the reset, but the reset is not finished. And it may well be reset further. In fact, I think it's a fair bet that it will be reset further when we go to scale, and when we go from having, say, 100 people in there to having as many as 1,000 people, subject to all the reasons I just listed, triage, how many flights, how many people actually come back.
You don't know how much they've increased, that their presence has increased from yesterday, or if there has been an increase in the numbers?
I understand there has been an increase, but I can't give you a figure, but I'm more than happy to come back to you. That'll be a matter where we'll simply ask Victoria Police exactly what profile they've got there now. And while we're at it, we'll get the date on which they assumed responsibility and began being a very significant presence there, not necessarily in numbers, but in the responsibility and functions that they have carriage of.
Just in terms of that, police generally don't give out the amount of officers that they put on to different things. Can we basically get that waived so we can find out how many
That's
are
not a
actually
matter.
in this?
That isn't a matter for me.
It's not a security matter though, it's more of a public interest.
Well,
Would
then
you like
can,
to
well,
see that information released?
Well, not. You can put that to Victoria Police.
In terms of compliance, are you concerned at all? There was a Roy Morgan poll saying people are getting less supportive of restrictions. Are you concerned that there will be an increase in people not being compliant?
I don't commentate on polls.
Do you
Good,
think
good,
that
bad,
people
or
will be less
indifferent?
compliant?
Good, bad, or indifferent. What I would say to you is that, in my judgment, the vast majority of Victorians are doing the right thing, and they know that we're so close to being able to take some big steps, and we've just got to stay the course here. That's what I think people. That is not, Alex, to say that people are necessarily thrilled with the circumstances we find ourselves in, but again, as I've said many times, none of us have the luxury of letting our frustration get the better of us, or getting to this place where we simply pretend it's over when in fact it isn't. So on that basis, all my advice from Victoria Police, all the data, all the briefings I get indicate that a very substantial majority, the vast majority of Victorians are doing the right thing, and they want, yes, they want it to be over, but they want it to be over the right way, if you like, done properly, so that when we find that normal, we can hang on to that normal for as long as we possibly can.
Has
Do you
there
think
been
that
any
feeling-
advice that compliance is declining?
No, I've not received any advice to that end. I think it's fair to say we could all, I think, agree on the fact that no one is enjoying the circumstances that we're in, and everyone would prefer that when I stood up here last Sunday, I could have announced that we could do all sorts of things. We could have weddings, for instance, with several hundred people at them. Sadly, that's not safe. That's not steady, and that's not the decision. But we will get to that point. We will get to that point. Don't hold me to the exact number, but we will get to that point. 350. Well, I most certainly cannot confirm when it will be that we can have 350 people at a wedding. But as soon as we can have weddings that are much closer to a normal wedding, if you can call that a normal wedding, we will get to that. We will get to that.
Do you think that
And that's what, and just on that, just to finish, I just say that's the most deeply impressive thing. People are not enjoying these restrictions, but they're still staying the course because they know that there's no alternative for us to do this other than in that safe and steady way. Unless, of course, we're prepared to run a pretty significant risk that, yes, we get open, but we can't stay open. So that's in many respects the most deeply impressive thing about it. People doing the right thing to achieve the outcome we all want, despite the fact that there's hurt and pain and that it's very challenging, both from an economic and financial point of view, but in a deeply personal point of view. There's a significant emotional toll with this, as well as all the other matters we've talked about in terms of mental health and family violence and all of those issues. They're critically important too, but the fact that people are staying the course is something that it's a real point of pride for me as the leader of the state.
Do you think that feeling of being less than thrilled has been compounded by the fact that we wouldn't be in this situation if your government had managed hotel quarantine properly?
Well, that's a matter for others to make a judgment about that. At a very personal level, I would have thought. I think people know and understand that the reality we face can't be kind of wished away. You can't pretend it isn't real. It is real, and they're the circumstances that we're in. But they can also, I think, with a sense of optimism, look at these numbers steadily coming down. Looking at this, they can see the strategy working. They can see regional Victoria in a different place, and they're desperate to get to that place. But they also know that you can't shortcut this. You can't sort of cheat your way to COVID normal. It's got to be done properly, and that's what we're determined to do.
Just a quick question for Alan, sorry. Can I finish the very? Yep.
Sure, no worries.
Sorry. Former Minister Adam Somyurek has obviously got an op-ed in the Herald Sun today. I know that you don't give him much kudos, but he did have a point about the crisis cabinet and the fact that he felt responsible that it should have never been allowed to happen. My understanding is that expired yesterday, did it? Has it been extended, and what date has it been extended to?
A couple of points. One, I have absolutely no comment to make on people who are deeply irrelevant to the work that I'm doing. That's the first point. And the second point is I've been clear that cabinet committees are a feature of cabinet government. They always have been. They always will be. This crisis is not over, and therefore arrangements that facilitate us laying down a strategy, prosecuting that strategy and getting it done, they haven't changed either. They won't be there forever though. They won't be there forever, but I don't know. I think it's important. Sorry.
Is there a date that it's been extended to?
No, it doesn't quite work.
Indefinitely.
It doesn't quite work that way, and I wouldn't say it was indefinite. There are structures in place. They don't actually expire. It's not like they're a function of law and they don't exist after a certain day. You can try and give indicative dates about when you'll move to a different structure, but if circumstances don't allow that, then you don't. So I can't tell you exactly when that will be, but it will. There's already been some changes actually in terms of some other cabinet working groups that have been stood up that are much more focused, if you like, on budget, recovery plan, investment, whether it be skills or significant projects, large and small, all of those things. Energy policy, for instance. There's lots of different cabinet working groups. There always has been. The alternative would have been, Alex, to simply have the Securities and Emergency Management Committee of Cabinet, which again is not a 22-member group. It's much smaller than that. Much smaller than that. But it doesn't include all the coordinating ministers. The other one, you could have had the coordinating ministers group, the CMC as it's known. That's identical in its membership. So cabinet committees have always been a feature of this. It's coming together as a total group is very important as well. Of course it is. But a big part of every Monday's cabinet agenda is confirming all the work that all the smaller groups have done in the preceding week. That's what always happens.
Has it been communicated to you at all that ministers are unhappy that this crisis cabinet is continuing?
No.
No one's informed you of that?
No.
Alan?
Sure.
Anyone else?
Just one
Okay.
Unless you've got any more for me.
Yeah, one more if you don't mind, please.
That's fine.
Organised online campaigns on various platforms, socials, etc. You've seen a few of them now, whether it be around organising protests, attacking you personally, trying to undermine the health effort. Do you think those campaigns and that feature of this past few months has been successful in undermining the public confidence in the health response?
No. I think the people, as I've just said, I think at length, maybe longer than I needed to, but I think people know and understand that the only way through this is not protest, it's not graffiti, it's not personal abuse, it's not, toxic partisan politics. None of those things are a vaccine against this wildly infectious virus. The only thing that works is everyone working, stay apart, yes, but stick together. Get the job done, stay the course. That's where we're at. And we're so close to being able to take a big step. And we've just got to all find it within ourselves, as hard as it is, to get that job done. That's what I'm committed to. And I think the vast majority of Victorians are too. At the same time, Noel, that doesn't mean there's a requirement for everybody to agree with the strategy. It doesn't mean there's a requirement for everybody to, to necessarily have the same view that the Chief Health Officer does, or that I do, or that Alan does. Debate's fine, but some of this stuff, I think people can make their own judgments. Some of this stuff is, it's nasty. It's not particularly accurate or based in facts or science. But again, you can't require people to conduct themselves that way. That's what part of being part of a free and frank democratic system's all about. But I just don't think people will not be swayed by that. I think the vast majority of people, as I said before, they know where we are. They know how close we are to being able to take big steps. And they want that done safely, though. So I probably can't say any more than that.
How far away are we on a decision about outdoor dining in the city?
I understand the city will have... There's a slight... it hasn't complicated the effort, but there's some slightly complex arrangements, I think, in place given the caretaker provisions around the City of Melbourne. But I think there'll be some announcements made later on today, and we've been working quite closely with the City of Melbourne, certainly at an officer level. I've had a number of discussions with the Lord Mayor Sally Capp about these issues, and it's a joint funding approach. I think it's going to be not just a feature of this summer, but I think some of these investments it'll be done to such a high standard, I think, that it can be a feature of every summer, where there's much more outdoor drinking and dining. There's a whole lot of spaces that finish up being reimagined, not just for now, but for the longer term. And whilst I'm not for a moment saying that there's an equivalence between space for 50 people outside with having your restaurant full, it's much better than being closed. It's much safer than everybody being inside. And I think it'll be here not just for one summer, but it'll be here for the long term. I'm actually very, very excited about some of these laneway projects, some of these precincts, looking at a range of public space that doesn't get used that way. I've been talking to lots of people in this sector, and whilst they all desperately want to be open, they also think that there is something quite positive here. That if we get it right, it can be there not just for this summer, but for a long, long time.
That's still going to be the plan for parks as well, not only laneways.
Yeah, I think you've got, just quickly, because Alan's waiting desperately to answer whatever this question might be. There are some places that have got outside on the footpath. They've got neighbours who don't need that space for themselves, so you could extend and have the frontage of a restaurant extending well beyond their actual address. Then there's, if you look at what they've done in New York, they've taken out a whole lot of street curbside parking and either put the pedestrian traffic into that corridor with bollards and things, or allowed there to be, if you like, the footpath is between two sets of tables, not just one, or three even. There's some laneways that can be closed off, and then there's also some parkland and other kind of civic space, if you like, that can be made safe, and it can be, to a certain extent, covered, not offending those rules about airflow and all of those things, density rules as well. I think there's a whole range of spaces that they're not well utilised at the moment, and I think they almost certainly can be, not just for one summer, but for every summer. Now, Alan, he's been waiting. Professor Ching?
Just on Alex's question to the Premier before, I'm just wondering if you're aware of any community infections from the staff at those hotels. It's been several weeks now since that happened. If they infected any family members or anything like that.
Sorry, I did catch the first bit. Which hotel?
Oh, from the spotless security guards.
I'm not aware of that. I'll have to get back to you on the details of that.
We've seen, I know we're supposed to be looking at the rolling day average, but we've seen increases in cases, slight increases in cases in the next 3 days. Should that be a cause for concern? We've also seen unknown outbreaks as well.
Yeah, so I mean, this goes to that what is the story behind these numbers? And certainly over the last couple of days, this cluster in Frankston and then spreading out to Chadstone certainly has accounted for not all of them, but a large number of cases. So it just reinforces, how important it is to make sure that we support this group of people and make sure that people around Chadstone come forward for testing to make sure that we've got all those close contacts and make sure that they're all looked after.
And just in Frankston, you think there's about 8 or 9 cases?
Yeah, I can't remember exactly, it's a complex situation, but it does involve a household, and as part of that area, it's not a public exposure, unlike Chadstone.
And do we know how the ref number is tracking?
Well, the ref number actually gets quite hard to estimate when things come down. The last number I saw was last weekend, and it was 0.69 from the national group, and I think 0.75, I think it is, from the internal modelling group. But there is a lot of uncertainty, excuse me, when numbers get down, and you would expect that the numbers have not changed a whole lot in the last couple of days. So the next run that will come off will probably be fairly stable, I think, and we would like to see numbers go down further.
Do you think this cluster in Frankston might slow that progress at all?
I mean, in some ways, it's good and bad. So obviously, it's not good to have cases, but the fact that we know that we can define where the contacts are, and we know who those people that are likely to get it is encouraging in one way. It means that we can stop this outbreak, as opposed to if there were 15 cases and we didn't know where they were coming from. But clearly, ongoing cases is still a concern.
Can you just take us back to the 5 kilometre restriction, and just talk to us a little bit about was there other, I guess, wider limits considered? How do we come down to the 5Ks? And was that a direct health?
Yeah, so what we're trying to stop is aggregate movement, and so it's a pretty nice day out there. You might imagine what the 1,000 steps in Dandenongs might look like on a day like today if there wasn't a 5 kilometre wall. It means everyone could drive up there, go up and down those steps, and be interacting. So what we're trying to do is prevent sort of aggregate movement. Obviously, there's reasons to go out for work and other reasons, but trying to keep people as local as possible so that they don't interact and potentially transmit infection.
Was there other limitations, or was the 5K just like, how did we get 5K?
Well, I mean, clearly there's no magic figure about 5K, but so in Israel, I think it's 500 metres. You can't go beyond your house. I think it was sort of the balance between allowing people to go the nearest shops and the nearest park and so on, and trying to keep people as local as possible. And
is that allowed under the state of emergency powers, or is it?
I understand it's in direction, and therefore that requires state of emergency powers.
And the 9 workers that got infected in the hotels since August, or wherever it was, is it still your understanding that they weren't infected at the hotels they got that from?
So I think we know that it's not part of one big outbreak because they're in different times and different places, but I understand that the investigation is ongoing.
That's a bit of a change from the language of the last couple of days, where it was sort of seen as unlikely that they had caught it at the hotels.
Yeah, there's still, as I think Brett mentioned yesterday, I think there's still genomic data still being processed.
How, without that genomic data, how were they able to make that assessment that it was unlikely? And wouldn't the assumption be, given that they were working in hotels with coronavirus positive people, that at least some of them would have caught the virus there?
So I understand that some of them live together, and that the transmission has occurred within the household in that setting. I don't have all the details of the other cases.
Sorry, just to clarify, so we will be able to get genomic data that will basically say whether cases have been linked back to the hotel quarantine program since the judicial inquiry was called? Yeah,
genomic data is pretty difficult to interpret, and one of the main limitations is it doesn't tell you direction of infection, particularly where people might get infected around the same sort of time. So if their symptom onsets at the same time, then you can't say that one person is given to the other or which way around it is. So it is quite difficult to work that out sometimes from that data. But I understand the investigation's ongoing, and once we have a bit more data, we can get back to you.
Which investigation or the inquiry is ongoing?
Sorry, the investigation of these cases and the genomic data, for example, is still ongoing.
Can I just get you to clarify the numbers, please? You said 8 cases linked to Chadston. Is that correct?
Yep.
And
So there are a number of cases linked to different outbreaks, but they do overlap, and I'm not sure exactly.
that's what we call a complex case, right? If we-
So a complex case is a case in a sensitive setting, so a single case in a setting. An outbreak is multiple cases, except in aged care and disability, where it's a single case. So
Okay.
the distinction is a little bit artificial, but it's significant for the way we respond to them.
So some of the cases in Frankston linked
Are
to
the same
Chadston.
as the ones in Chadston, and there's an overlap.
And there's an overlap, but we don't know how many in total in the Frankston.
I'll have to get those numbers for you. I
Okay,
don't have
thank
that.
you.
Yep.
Show release, Mike.
Yep. Yeah, in the CHO release. Thanks.
There's a pop-up testing centre in central Victoria that's urging people in the town of Rochester to come forward and get tested, even if they don't have symptoms. Is that necessary to do that where there isn't many cases, or should that be done?
I'll have to confirm that. There's no. I'm not aware of any cases in Rochester at the moment. But,
I don't think there is, but they're just urging people to get tested anyway.
Yeah, I'll have to get back to you on that. I'm not sure about that situation.
We'll definitely check that. We'll definitely check
Is that the one?
Yep.
Okay.
Any other issues? If not, thank you.
Thank you.
And we'll see you tomorrow.
You're 100%. It will be a milestone for you and not for me.